My name is Helene Feldman. I currently serve as chairman of the board of directors of American Friends of Sheba Medical Center at Tel HaShomer, which is the largest hospital in the Middle East. Israel has started to embrace integrative medicine and the concept of wellness before illness. We call Sheba the hospital without boundaries. We really push the boundaries in terms of medicine, and we are very dedicated as a hospital to not only treating the disease, but treating the patient. And through pushing these boundaries, we seek out alternative and integrative methods to treat our patients. Obviously, there's traditional Western medicine. If you have cancer, there's chemotherapy, there's radiation treatment and surgery and all the other things that we know that heal, and yet they also destroy. And when I say that, we've recognized that something like chemotherapy may heal the cancer, but it destroys the body. And our goal is to heal the body, create a stronger immune system, create a stronger person so that when we send that person out of the hospital, they're not only healed of the cancer, but they're healthy and they're prepared to live and lead a healthy life. One factor that we all know contributes to disease is stress. And it's a very simple. I mean, you have stress, you get a headache, you have a stomach ache, you get a pimple. Stress just definitely affects the body. And if you ask 10 people how to remove stress from their lives, I imagine you'll get 10 separate answers. I think the first step is to acknowledge that you must remove stress. One of the things that I did learn at the hospital in terms of treating the vertical treatment, mind, body, and soul, is what we do with a lot of our very ill patients is we provide massage therapy, and facials, which sounds like a very simple thing. But I was in the room as a woman who was very sick with cancer was receiving a facial. And, you know, she had her hair, just like you would do it in a spa. And I watched the therapist massage her cheeks. And she just, with this continual movement, just massaged her cheeks. And I could see this woman's body just melt. And I could see the stress, the disease just fall away. And I came home and I was visiting with my mother, my own mother, who suffers from Parkinson's disease. And she was going to an affair, and I said, "Why don't I do your makeup for you?" And she closed her eyes and she put her head back, and I took the makeup and I put it in my hand and I started massaging it into her cheeks the way I had seen them do it. And I have not seen that look on her face for years. And it just, her whole body, as they did in the hospital, just de-stressed. And when I stopped, she said, "No, do more." And she goes, "I'm ready, do more, do another color." It's not only the patient that has the disease, it's the family that's experiencing the disease. And we really need to address it as a whole, as a totality of a family, not just the individual patient. I'd like for our supporters and for the general public to come and to see and to learn how we're treating the patient that's ill and derive from these therapies a way to apply it to one's own life before the disease sets in.